Namaste and good afternoon from all of us at Apollo Hospitals. We hope you're well, fit, healthy, and happy. This is Dr. Srinidhi Chidambaram, and I'm very happy to welcome you to our Facebook Live session for today. At Apollo Hospitals, with our motto for touching lives, we place great importance on creating health awareness among people, as we know that knowledge and the right medical decisions at the right time can make the difference between life and death, especially in critical and emergency situations. A drug overdose is one such situation. A drug overdose refers to taking too much of a substance, whether it's a prescription medication, over the counter medication, or a legal or illegal drug. And also, drug overdoses can be accidental or intentional. If a person has taken more than the recommended amount of a medication or drug, enough to have a harmful effect on the body's functions, it is considered an overdose. An overdose can lead to severe medical complications, including death. The severity of a drug overdose really depends on what drug it is, the amount that was taken, and also the physical and medical history of the person who has overdosed on the medication. So let us, in this series on medical emergencies, today discuss what you need to do in the event of a drug overdose. To explain this to us, I am delighted to welcome Dr. Manoj Singh, who is a senior consultant from Apollo Hospitals, Ahmedabad, in critical care, sleep medicine, and respiratory medicine. Dr. Manoj Singh is a senior consultant, as I said, in chest and critical care at Apollo Hospitals, Ahmedabad, since 2005. He is a regional faculty for the American Heart Association for conducting AHA-led CPR courses in Western India. He is the director of Spectrum Medical Education, which is an authorized international training center for American Heart Association courses for CPR in children and adults in Apollo Hospitals, Ahmedabad. He was secretary and chairman of Indian Society of Critical Care Medicine, Ahmedabad branch, and also the zonal member for ISCCM. He is faculty in the National Chest and Critical Care Conferences, a teacher for the DNB Critical Care, Indian Diploma of Critical Care Medicine, Indian Diploma of Critical Care Nursing, and at the Apollo Hospitals International Limited. He is an ICU assessor and examiner also for the College of Critical Care of Medicine, and also a member of the National International Chess Societies. He's conducted many CMEs, workshops, conferences in critical care in Gujarat for doctors and nurses, organized Gujarat's first conference and trends in interventional pulmonology in 2012 and 17, and presented various papers and posters in national conferences. Welcome, Dr. Manoj Singh, to this session. Thank you so much.
Thank you. Namaste, everyone.
Yes. So we look forward to hearing your valuable views on first aid for medication overdoses. So let's begin at the beginning, and please let us know, what is a medication overdose?
Yeah, so it is divided, as you rightly said in the introduction, it is divided into two forms. One is a medical pharmacy drug given to the subject or their family members as a regular treatment for their diseases which it was prescribed for. Either you take it intentionally or unintentionally in the prescribed dose or more prescribed dose, or you take it more often without informing your medical person, authorized person, or your family member. So that is one part of overdose. Means that the dose, say for example, was prescribed 500 mg 2 times in a day, and you probably are taking more than 4 times in a day, because that is what is giving you physical or mental relief. That is your own self treating it on your own, taking it more. Or maybe your own family member, intentionally or unintentionally, seeing you taking that, starts consuming. If they have any other negative connect to their own mind, and they take it entire packet or entire number of strip which are available, They take it at one go. So that is considered as overdose. Or second thing is non-pharmacy things like some illicit drugs, your toilet cleaners, any other chemicals available, like commonly we see at intensive care unit. People take the hair dyeing things, people take some oils, which are again not meant to be consumed, but they consume either intentionally or unintentionally. So anything which is taken, which is not prescribed by your doctor, can be an overdose in the human body.
Right. So, what are the common, I mean, I know the list is long, but in your experience, what are the most common types of medication that can be overdosed on?
Yes. The first common thing which we see in our area, it's again very geographically. So when you see in south, it is different when you see in north and in the west and the east. So in our part of the country, we see generally people take more of blood pressure medicines, maybe themselves or accidentally of their parents, because those are the ones which are actually available in bulk. Generally prescribed medicines are for 3 months or 4 months duration. They're lying actually over the drawer or the closet. And that is when people accidentally take it or intentionally take it. So these are the blood pressure medicines, first number. Second is painkillers. They take more often than not. And third is anti-anxiety medicines. Means people think that taking more will give them less anxiety or a comfortable sleep. So these are the top three drugs which people come from educated background. From rural background, we see generally drugs which are meant for farming. So that is not considered as an overdose. That's considered as a poisoning. So overdose are these three drugs which we commonly see.
I think a lot of it is also because here a lot of medicines can be bought over the counter in the pharmacy, or people sometimes buy from the pharmacy without even a doctor's prescription.
Yes.
So maybe that might be one of the reasons.
Yeah. So if we go to the reasons, as you rightly said, the common is easy availability. Second is lack of knowledge of ill effects of overdose.
Yes.
And
definitely.
third is not keeping it in a safe area. Means suppose, as I said, it's always lying in a packet or in an area which everyone in the family knows these are maybe grandpa's medicines or father's medicine. They're just lying there. And that easy access in India actually should be really cautiously thought about. As you might, we can just say this message from this seminar that please, don't house medicines in a very easily accessible area.
Yes. So what are the other reasons why people take these overdoses, or intentionally or unintentionally?
Yeah, see, now we are sitting in almost a post-COVID era. So most of the time, it's very time dependent also. As the student is appearing for his exam, so we see a very lot of ups and downs during this phase. When suppose this is a time when you have a lot of competitive exams coming in, so stress factor is so high, anxiety is at the peak, or maybe when the results come in. That is one thing. Second, people, or the second reasoning which we see is perimarital issues happening, something happening wrong or some the other way things, Or third is family matters only, family, abusive family. We had a recently a patient of very young girl, just because parents wanted her to become this and she didn't want to become, stopped speaking, and they never brought to any medical attention. She took her own father's medicine and this came as poisoning. So these are the common reasons which we see. And last is not the least, any people who are addicted chronically to one thing, say for example, alcohol. They in that state, intoxicated state, can actually in craze or maybe in terms of showing to the peers, they start taking something which is considered as overdose.
So what would be, I mean, though it is difficult to generalize because medicines can be very different, but how does one spot that somebody has, taken this overdose of medicines? Because when usually it will be the family or somebody nearby who spots it. So what are the signs that one must be aware of?
Yes. So signs, suppose signs can be reported by the patient himself or the family members or the persons who are working in the office. So if the patient has to report the signs, so honestly at that time he has a guilt or he took it accidentally. If patient comes to the hospital or to the family member, definitely they will report stomach symptoms first. You may feel nauseating, you may have a lot of vomiting, you may have severe stomach discomfort. If the drug is actually cardiotoxic, means if it was meant for blood pressure, they will have dizziness, they will have lightheadedness, they will have drowsiness, signs of low blood pressure. If it was an anti-anxiety medicine, the patient can report excess sleepiness, lightheadedness again, giddiness, and feeling, so light that he's not able to do his routine activity. Or he may have history of fall downs in the morning. So that is when the patient reports that sign. Or if the patient has taken a medicine which was affecting the kidney, he can have more urination, or he can have increased thirst. Or if he has taken medicines of diabetes, which is again of not very uncommon. So we also see diabetic medicines also consumed in an overdose format. They can have signs of low sugar. They might eat more, or they may have severe perspiration. They may have palpitation. They may actually have syncopal attacks. Or if the medicine was taken for pain, they can have severe vomiting. All the painkillers actually are extremely stomach unfriendly. If you take it too much of paracetamol, too much of ibuprofen, combiflams, ultraseds, you can definitely have a severe GI upset. And last but not the least, if this is in a chronic format, suppose you are prescribed only 2 tablets per day, or you are taking more than two over a period of few days, then you might manifest as chronic overdose like jaundice, lethargy, swelling of the feet, urine coming less, not eating regularly. So these are signs which are reported by the patient himself. When the family sees the patient taking an overdose, the symptoms are different. They are either found sleepy, either they are found unconscious. That happens typically in the morning. They were together in the evening. The drug is consumed when the patient was alone at his home or his bedroom, and they don't wake up. So they bang the door, or full of froth he's lying into. He would have had a convulsion, or he's just not moving in a cardiac arrest. Or third is when we see those patients brought with atypical symptoms. We recently had a patient whom we never suspected, but they were living with a caretaker, and the caretaker was actually giving overdose. So the patient came with altered sensorium. We thought it is stroke, but when we got the drug level done, because stroke was negative, MRI was normal, the patient was only brought in an unconscious state. So we found that he was being overdosed by the caretaker as well. These are the common signs.
Right. So what is the point when this is considered a medical emergency and you have to immediately rush to the ER as opposed to a chronic or some few tablets more being taken?
Yes, I feel any overdose needs a medical attention. So if you have anyone with overdose, or you accidentally take an overdose, you do not wait for time to settle down, because these are nasty chemicals. Even as you all know, when we prescribe you tablets, we always first thing is pray to God that this will help you. But when you know that you have taken it more, it is definitely not going to help you. It is going to harm you. So any overdose, maybe 1 or 2 tablets extra also, let us decide how you will behave in the coming 12 hours to 24 hours. So please reach the nearby hospital, reach us at Apollo, call us at our number 1066. We are there to help you. So any overdose needs a medical attention. But your question was very specific. When it is serious. So serious are when you start having abnormal physiology. Physiology means you were supposed to eat, but you don't have any hunger. You start puking up. You start having rashes. You start having allergy. You start turning red. You start turning swollen. You start having low blood pressure symptoms, as I mentioned, or you start feeling more sleepy. You have severe, terrible pain, which generally is not the routine behavior of our body. Or whatever you take, you're not even consuming water because you're puking it out. So these are medical emergencies, and that is where in emergency room we triage these patients, and we generally keep them in intensive care unit for at least 12 hours for observation, unless we have some supportive tests coming in.
Are there any first aid measures that people must do before, or is it advisable to not tamper with anything and just come straight to the hospital?
Yes, we generally say that there are big do's and don'ts.
Yeah, there are.
So, what you should do at home when you find someone with a drug overdose. So, let's talk about what you should do. You should make them lie in comfortable position. If they have giddiness, they have lightheadedness, they have feeling of something rotating around them, so they should be made to lie down. Never this, so one is do. So here, the same person who's made to lie down, never feed them, never give them water in lying down position, because that will increase the risk of that going into the lungs. Never ask them to smell a very, very cranky thing like, onion, shoes. Don't ask them to smell, or don't force something through the nose just because some myth prevails in our family. Any semi-conscious person might wake up and say thank you. So no one is going to say thank you. So don't do that. So that is the first thing. Second thing, if someone has abdominal pain, many local remedies are given. Unless you know what you are giving, unless it is easily available, like local antacids, some sodas for acidity, if patient is telling you, that is fine. But if you feel I'll make something, cook something to prevent vomiting, don't do that. Some light thing can be tried for patients who are not unconscious, telling you that I have a lot of acidity. But if they don't get better, don't go beyond. The third first state is if the person is having convulsion, is seizuring away, or he has a lot of froth, make them lie down in a recovery position. So, what is a recovery position? A patient is made to lie supine, and then you turn on one side, and so that one arm just rests over the body and on the bed, and this mouth is dependent to the bed, so that if he vomits more, the vomitus does not go into the lung. And that is the time you are not feeding or making him smell something which is very odd. So that is a recovery position. Next first aid is if the person is having less urine or maybe feeling tired, body ache, just ask them to lie down. You can make some drinks like ORS at home, make them feed. You definitely know he has taken a BP medicine, which is not required, or it was an overdose. So increase the BP. You can give some salted, aerated drinks, or he can just have one and then immediately rush to the hospital. And last first aid is most of the times when they have injury related to fall down of a drug overdose, you have to actually apply pressure at the bleeding area. Do not tie that area too tight. Do not tie a tourniquet to the limbs which is bleeding, and then call us. We are always a call away, and reach to the hospital. So these are some common first aid which we generally advocate.
Another thing which people sometimes do when they say that, there's an overdose of some medicine is to make them drink a lot of water to flush it out. Or, sometimes they have this practice of giving them something to make them vomit. So I
Yes.
guess all this should not be done, right?
Yes. In fact, giving banana, giving this soda related drinks, giving alcohol related drinks, and so that it gets flushed from the kidneys or the stomach. I agree with you. These are prevalent myths. Do not think that what you will give will dilute the chemical which accidentally your patient or family member has taken. There are definite antidotes available, which we will do it if we feel they are appropriate enough. Say, for example, as you rightly said, ma'am, we have seen patients accidentally consuming the toilet cleaning solutions, which are actually kept in old mineral waters bottle,
Yeah, just like
because
water.
that's like a look-alike thing, and you just drink it and it's just full of fraud and all that. And to dilute, people generally give a opposite thing. Suppose he thinks he has taken acid, he gives alkali, or he's taken an alkali, he takes acid, or takes a water or a lemon water. So don't do this. If you have a burning sensation in your throat just because you have accidentally consumed something, stop there. Do not do anything, just reach to us. Don't consume ice. People drink a lot of ice cubes. Don't do that. The hot will not be get cured by cold, and vice versa. So that is also a big myth, and we should advocate all of you not to practice this at your home as a first aid.
So what happens once a person actually reaches the emergency in case of an overdose?
Yes. As soon as they reach, first come first, we always see for A, B, C, D, E. So A means airway and breathing. Means if he is breathing, he is conscious, airway breathing is fine, oxygen level is fine, he is not breathless. That means major life-threatening oxygen-related emergency is not going to set in soon. C stands for circulation. Means how is the pulse, what is the rate, what is the rhythm, what is the blood pressure. If that is okay, we go to D. D means decontamination. Decontamination of the poison, if that is possible. So decontamination, suppose he has consumed a lot of poison in the mouth, or the drug is in too much quantity, and I will advocate all of you to reach within an hour. If you reach within an hour to us, generally speaking, none of the drug overdose will hamper your A, B, C. Means you will be safe within 1 hour if you reach to us, because at that time our gastric juices, stomach digestion does not take place so fast. So they are still lying in the subject's stomach. So decontamination. So we can put a stomach tube or a rice tube, a large Bose tube from the nose to the mouth. We can give solution which can induce vomiting or dilute it, and we can do a gastric lavage. We can just take it out rather than you doing it at home, flushing it through the stomach or the kidney. This is a more scientific and approved method to decontaminate. Then comes E. E means exposure. Many a times there are caustic sodas or all these things which when you do it, you can also get it. Or his eyes can get burned if you just ask him to cough out or vomit. Many times people put finger in the mouth, spoon in the mouth to induce vomiting. That is also fine as a first aid at home or on the way. But unless the patient is fully conscious, you know that thing which he has consumed is not going to cause vapors, and the patient is stable enough to vomit in a dependent area, not his lying flat. So environment, that is exposure, sometimes it is spilled over the all his dress, so we remove it, we give him a wash, and then we start definitive care. So airway, breathing, circulation, decontamination, and exposure or elimination of the poison on the skin and the eye surfaces.
So, what about children? So, when young children also have this tendency to inadvertently take these medicines and consume them, so is there anything differently that needs to be done for such children?
Yes, in children, we see commonly foreign bodies being consumed. Drug is not that common, but of course, as I said, it is not uncommon in current era because of easy access, them being at home most of the times. And third is they do not know whether they have swallowed or put it in the mouth and forgot. So many times they come with a lot of barking cough kind of a thing. So that is called choking. So
Yeah.
if they have choked the tablet, if they are breathing and you only feel a noisy breathing coming in, do not do anything. Do not do anything. If they have consumed in the mouth, do not encourage them to vomit, because children are very sensitive. The stomach size is hardly like this much, hardly this much. So they will anyhow vomiting out themselves. Do not encourage anything to children. If they have a noisy breathing and they look a little drowsy to you, then that is the time you should be really alerted that he might, the trachea, the windpipe is so small that the child can stop breathing because he has stopped coughing. And that is the time we show them a first aid method called Heimlich maneuver. But unfortunately, and now I can't demonstrate to you, but if you want, we can actually share on the Facebook session only,
Yeah.
post our session, how to do a Heimlich maneuver. But if the child is unconscious, do not attempt anything, just reach the emergency. The last subset, ma'am, is the person who is not breathing. You have found a person in your home not breathing, not moving. So these are the patients who actually are into cardiac arrest post overdose. It can be a child or a normal adult or an elderly adult. That is the time, even if you don't know when they have consumed. Say, for example, you knock the door in the morning and they have not woken up, and you go and you feel that he's not moving at all, he's not breathing at all. So that is the time when, without wasting time, start what is called as cardiopulmonary resuscitation, CPR. So that is one addition on top of what we have already discussed before he reached to the hospital. So when he is in cardiac arrest, do CPR no matter what the age of the victim is.
What are there any ways at all to prevent drug overdosing, in the sense that, apart from we did already speak about safe storage of medicines, but is there any are there any risk factors, or are there a particular type of people who are prone to this?
Yes, children are prone to it accidentally. People who are illiterate and do not know many a times when they are prescribed polypharmacy. If your family member have more than 10 medicine ongoing, and there are some confusing medicines, twice in a week, thrice in a week, every Saturday, Sunday off. Those are the things where you should always be giving them in supervision, because there are medicines who are actually, if taken daily, become an overdose. So if you are prescribed because of chronicity of disease more than 10 medicines, or you are on insulin, so these medicines should be given under supervision. Don't keep it in your routine fridge. Many times insulin is kept there only, and many times it is kept in a nozzle. And if you can just take it, people may not know what it is. They can actually do it and mix it with some food substance. You can have an overdose there. So storage, as I said again. Second is supervision. Third is, do not house medicines which are more than 2 weeks of stock, because there is no point. We have now Apollo Pharmacy gives you this box where you can only store it for a week, and when it is consumed, you just take it out from your safety locker or wherever, and then again cut and put it. So not house more medicines. Then next thing is, people who have psychiatric disease at your home, they are very prone. People who are addictive to ethanol, tobacco, in verge of their rage or anger or fear or something, when they are alone or in their bedroom, you have to be vigilant in the room daily. So as your maid cleans their house, you became their medical maid and you remove the medicines which they have housed. And they should be really checked for whether they have had a habit of taking some more drugs over what they've already been taking. So prevention is always better than having this nasty emergency. This is middle of the night or early morning, and just you all being in an awkward situation.
Absolutely. And finally, I just wanted to ask you, in these kind of cases where there is a potential for abuse of these medications, where it's intentional, is there any psychological support or counseling that people must also take so that this doesn't happen?
Yes, I think again here prevention is better than cure. As I said, you pick your peers or you pick your family members, notify us, notify the psychologist, or notify people whom you confide to, or notify your family doctor that such a such person in my family is now going into this direction. And see, and in this modern world, it is not uncommon to get medicines at doorstep. You order, it will come within an hour. Now people take pride not going to the pharmacy. They tell us that, sir, this is available, we are getting it, and they take pride to get it, and they take pride to get it in a faster and a more easier and a cheaper way. So we should be vigilant. Psychologist plays a definite role here. If you feel that your family member is not following the medical advice or taking his own medicines, please inform your family doctor. Again, as you know, psychologist or psychiatrist may be a taboo in your family, but it is the person, he or she is the person to confide to if you accidentally have fallen in a habit of taking more and more drugs to remain in a normal mental or a social group.
Absolutely. Is there anything else you would like to add, doctor, before we conclude the session?
Yes. If you come to the hospital in emergency, the two things it's very mandatory is, as I said, life risk, mental trauma is definitely there when you have an accidental overdose. Treatment sometimes becomes very costly. Say, for example, if you take a overdose of BP medicine, many a times you end up in ICU for days together because all the BP medicine have a longer half-life. The cost incurred is not covered by any insurance people. Remember this. So it's always better because you end up paying from your pocket. No company will support a drug overdose because it's not a medical disease. The second thing is a very social dilemma. Whenever you come to us, the medico-legal inquest is always put. Always MLC is put. So to avoid those nasty areas or your society, you will see that police will come to you. They will inquire, kisne diya, how you got it, why you got it. So that's again an unfriendly area. Here you are paying from your pocket, a police is coming. So sometimes it becomes a very unfriendly environment to us as a doctor as well. You also face the heat, we also face limited. So ultimately, to avoid this, drug overdose is just around the corner in your home. Pick that area, pick that person. Please avoid drug overdoses accidentally or intentionally in your family. Connect to us. We are there to help you. And this is the basic message. drug overdose is a completely treatable or preventable error in common world.
Thank you so much, Doctor. So, viewers, I do hope that you found the session informative. So, as the doctor said, do remember that drug overdoses can be prevented. The best methods are to remove the opportunities for accidental overdose or triggers for intentional overdose in the first place. If you have children in the house, make sure that all medications are kept well out of reach. And if you use prescription drugs, be sure to use them only as directed by the doctor. Do not combine medications, do not overdose, do not increase your dose without asking the doctor. So take care, remain safe and well, and do remember that our 1006, which is our emergency helpline, is always available to help you through any emergency. Thank you and
Thank
namaste.
you. Namaste.